I want to talk to you today about something that could genuinely save your life, or the life of someone you love, and that a great many people, including older adults, don't know as well as they should. How to recognize a stroke, and why acting immediately matters so enormously. Because a stroke is one of the most serious things that can happen, a leading cause of death and lasting disability. And yet many people don't recognize the signs when they're happening, or don't realize that a stroke is a dire emergency where every minute counts, so they delay, and that delay can mean the difference between recovery and permanent disability or death. So today I want to make absolutely clear how to recognize a stroke, using a simple method anyone can remember. Explain the other signs too. Stress why getting emergency help instantly is so critical, and tell you exactly what to do. And I'll be clear and direct because this is genuinely a matter of life, death and lasting disability. And knowing the signs of a stroke and acting at once can save a life and prevent terrible disability, which makes this one of the most important things you can know. Let me start with what a stroke is, because understanding it shows why speed matters so much. A stroke happens when the blood supply to part of the brain is suddenly cut off, usually by a clot blocking an artery to the brain, or sometimes by bleeding in the brain, so that part of the brain is starved of blood and oxygen, and brain cells begin to die. Because brain cells, once they die, don't come back, and because the area of dying brain grows the longer the blood supply is cut off, a stroke is a dire emergency where time is critical. The faster the blood flow is restored, or the stroke treated, the more brain can be saved, and the better the chance of survival, and of recovering without lasting disability. There's a saying in stroke medicine that time is brain, meaning that with every minute a stroke goes untreated, more brain is lost. So a stroke is a sudden interruption of blood to part of the brain, causing brain cells to die, and it's a dire emergency where every minute of delay costs brain and worsens the outcome, which is exactly why recognizing it instantly and getting emergency treatment at once matters so enormously. Understanding that time is brain is the key to why this knowledge is so important. So a stroke is a brain emergency where speed is everything. Let me give you the simple, crucial way to recognize a stroke, because this is the part to remember above all. There's a simple method, widely taught, often remembered by the word fast, that captures the main signs of a stroke and what to do, and I want you to remember it. F is for face. The face may droop on one side, the person may be unable to smile evenly, or their mouth or eye may have drooped, so ask them to smile and look for one side drooping. A is for arms. There may be weakness or numbness in one arm, so ask the person to raise both arms and see if one drifts down or they can't lift it, and weakness can affect a leg too. S is for speech. Their speech may be slurred, garbled, or they may be unable to speak or to understand you, so listen for slurred or strange speech or trouble understanding. And T is for time. If you see any of these signs, it's time to call emergency services immediately. So the fast signs are face drooping, arm weakness, speech difficulty, and time to call emergency services. And remembering fast gives you a simple, powerful way to recognize a stroke and know to act at once. This is the single most important thing to take from today. Face, arms, speech, time. So fast, face, arms, speech, time is the key to recognizing a stroke. So remember fast above all. Let me give you the other signs of a stroke too, because while fast captures the main ones, strokes can show other sudden symptoms worth knowing. Beyond the face, arm, and speech signs, a stroke can cause other sudden symptoms, and the key word is sudden, since stroke symptoms come on suddenly. These can include sudden numbness or weakness of the face, arm, or leg, especially on one side of the body, sudden confusion or trouble understanding, sudden trouble speaking, sudden trouble seeing in one or both eyes or double vision, sudden trouble walking, dizziness, loss of balance or loss of coordination, and a sudden severe headache with no known cause, sometimes described as the worst headache of one's life. So in addition to the fast signs, be alert to any sudden numbness or weakness, especially on one side, sudden confusion or trouble speaking or understanding, sudden vision trouble, sudden difficulty walking, dizziness or loss of balance or coordination, and a sudden severe headache. The common thread is the sudden onset of these neurological symptoms. So knowing that any of these sudden symptoms, alongside the fast signs, can mean a stroke helps you recognize the full range, all calling for immediate emergency help. So sudden neurological symptoms of any of these kinds can signal a stroke. so know the fuller range of sudden stroke signs. Let me stress why acting immediately is so critical, because this is the heart of it, and where lives and futures are saved or lost. As I explained, a stroke is killing brain cells minute by minute, and the area of damage grows the longer it goes untreated, so the speed of getting emergency treatment directly determines how much brain is saved and whether the person survives and recovers or is left with lasting disability, like paralysis, speech loss, or worse. Crucially, there are emergency treatments for stroke that can dramatically improve the outcome, but they're highly time-sensitive, only able to be given within a limited window early after the stroke begins, so getting to hospital by emergency ambulance as fast as possible is what makes these treatments possible and saves brain. This is why you must call emergency services the instant you suspect a stroke. Not wait, not see if it passes, not lie down and hope. Because every minute of delay costs brain and worsens the outcome, and delay can turn a recoverable stroke into permanent disability or death. So acting immediately is critical, because a stroke damages the brain minute by minute, because time-sensitive emergency treatments can dramatically help but only if given fast, and because delay costs brain and futures, which is exactly why instant action on recognizing a stroke is so vital. So immediate action, because time is brain, saves lives and futures. Let me be absolutely clear about what to do, because this is the life and future saving part. If you see any signs of a stroke in yourself or someone else, any of the fast signs, face drooping, arm or limb weakness, speech difficulty, or any sudden numbness or weakness, especially on one side, sudden confusion, trouble speaking or understanding, vision trouble, difficulty walking, dizziness, loss of balance, or a sudden severe headache, call emergency services immediately. Your local emergency number, and say you think it's a stroke. Do this the instant you suspect it, even if you're not certain, even if the symptoms seem to be easing, because a stroke is a dire, time-critical emergency, and it is far better to call and be wrong than to delay. Do not wait to see if it passes. Do not lie down and hope it resolves. Do not drive yourself or the person. Call an ambulance, because the emergency services can begin care and get the person to the right treatment fastest. Note the time the symptoms started, if you can, since that's important for treatment. And while waiting, keep the person safe and calm, and don't give them anything to eat or drink, since their swallowing may be affected. So the moment you recognise possible stroke signs, call emergency services immediately, even if unsure or if symptoms ease, without waiting or driving yourself, because instant emergency help saves brain, life, and the chance of recovery. So calling emergency services the instant you suspect a stroke is the essential, life-saving action. Never wait. Let me address a crucial point about symptoms that pass, because it's dangerously misunderstood. Sometimes stroke symptoms appear and then go away within minutes or up to a day, which is called a transient ischemic attack, a TIA, or sometimes a mini-stroke. People often think that if the symptoms passed, it was nothing and they don't need help, but this is dangerously wrong. A TIA is a serious warning sign that a full, devastating stroke may follow, often soon, so it's a medical emergency too and must be acted on. So if stroke symptoms occur, even if they pass and the person seems fine again, you must still call emergency services or get urgent medical attention immediately. Because a TIA is a warning that needs urgent assessment and treatment to prevent a full stroke. Never dismiss stroke symptoms that go away as nothing. They're a serious warning to act on at once. So the key point here is that stroke symptoms that pass are still an emergency, a warning of a possible coming stroke, and must be acted on urgently, not dismissed. So even passing stroke symptoms demand immediate action. So never ignore symptoms that resolve. Let me briefly mention reducing stroke risk too, because prevention matters alongside recognition. While recognizing and acting on a stroke is the focus, you can also reduce your risk of one through many of the same measures that protect the heart, controlling high blood pressure, which is the single most important risk factor for stroke, not smoking, managing the irregular heart rhythm, atrial fibrillation, which I've discussed and which raises stroke risk, with your doctor, including any prescribed blood thinning treatment, controlling cholesterol and diabetes, staying active, eating well, and limiting alcohol. Taking any medications your doctor prescribes to reduce your stroke risk consistently is important. So, alongside recognizing a stroke, reducing your risk through controlling blood pressure, not smoking, managing atrial fibrillation, and other conditions. And healthy living, with your doctor's care, is genuinely valuable. But whatever your risk, recognizing a stroke and acting instantly remains essential for everyone. So reduce your risk and stay ready to recognize and act. So prevention complements, but never replaces, instant recognition and action. Let me paint you a picture of how this matters, because the contrast is stark and real. Picture an older woman whose husband suddenly can't smile evenly, one side of his face drooping, his arm weak on one side, and his speech slurred. In the tragic version, they're unsure what's happening. Think maybe he's just tired or unwell, decide to wait and see if it passes, perhaps lie down for a while. And by the time they realise it's a stroke and get help, hours have passed, the time-sensitive treatments are no longer possible, much brain is lost, and he's left with permanent disability, the delay having cost him dearly. Now picture her knowing fast. She instantly recognises the face drooping, arm weakness, and speech difficulty as a stroke, and calls emergency services immediately, saying she thinks it's a stroke and noting when it started, without waiting. He's rushed to hospital, gets time-sensitive treatment fast, much of his brain is saved, and he survives and recovers far better, perhaps with little lasting disability. Same stroke, but recognising it instantly with fast and calling for help at once, rather than waiting, made the difference between devastating disability and recovery. That contrast is exactly why knowing the signs of a stroke and acting immediately is one of the most important, life and future-saving things you can know. So instant recognition and action changed everything. And let me speak directly to those of you caring for or close to an older person, because you may well be the one to recognise a stroke and act, and your speed could save their life and future. Learn and remember fast. Face drooping, arm weakness, speech difficulty, time to call emergency services. And know the other sudden signs: numbness or weakness, especially on one side, sudden confusion, trouble speaking or understanding, vision trouble, difficulty walking, dizziness, loss of balance, or a sudden severe headache. If you see any of these in a loved one, call emergency services immediately. Say you think it's a stroke. Note when symptoms started. And do not wait. Do not let them lie down and hope. And do not drive them yourself, because instant emergency help saves brain and futures. Crucially, know that even if the symptoms pass, it's still an emergency, a TIA warning of a possible coming stroke, and needs urgent attention. You can also help reduce their stroke risk by supporting control of blood pressure, not smoking, management of atrial fibrillation and other conditions with their doctor, and healthy living. Knowing fast and acting instantly is one of the most important things you can do for an older loved one. So your instant recognition and action could save their life and spare them disability. Let me draw this all together. Recognizing a stroke and acting immediately is one of the most important life and future saving things you can know. A stroke is a sudden interruption of blood to part of the brain, causing brain cells to die. And it's a dire emergency where time is brain, every minute of delay costing brain and worsening the outcome. The key way to recognize it is fast: face drooping, arm weakness, speech difficulty, and time to call emergency services immediately. Other sudden signs include numbness or weakness, especially on one side, sudden confusion, or trouble speaking or understanding, sudden vision trouble, sudden difficulty walking, dizziness or loss of balance, and a sudden severe headache, the common thread being sudden onset. Acting immediately is critical because the brain is being damaged minute by minute, and time-sensitive emergency treatments can dramatically help, but only if given fast. So the moment you suspect a stroke, you must call emergency services immediately, even if unsure or if symptoms ease, without waiting or driving yourself, noting when symptoms started. Crucially, stroke symptoms that pass, ATIA, are still an emergency and a warning of a possible coming stroke, to be acted on urgently, not dismissed. And while reducing your stroke risk through controlling blood pressure, not smoking, managing atrial fibrillation, and healthy living with your doctor is valuable, instant recognition and action remain essential for everyone. So here's what I'll leave you with. First, understand that a stroke is a dire emergency where time is brain, the brain being damaged minute by minute. So recognizing it instantly and getting emergency help at once is critical to saving life and preventing lasting disability. Second, remember fast above all. Face drooping. Ask them to smile and look for one side drooping. Arm weakness. Ask them to raise both arms and see if one drifts down. Speech difficulty. Listen for slurred or strange speech or trouble understanding. And time. If you see any of these, it's time to call emergency services immediately. Third, know the other sudden signs too. Sudden numbness or weakness, especially on one side. Sudden confusion or trouble speaking or understanding. Sudden vision trouble. Sudden difficulty walking. Dizziness or loss of balance. And a sudden severe headache all coming on suddenly. Fourth, and most importantly, the instant you suspect a stroke. Call emergency services immediately, even if you're not certain, even if the symptoms seem to be easing, without waiting to see if it passes, without lying down and hoping, and without driving yourself or the person, and note when the symptoms started. And fifth, never dismiss stroke symptoms that go away, because a TIA is a serious warning of a possible coming stroke, and still needs urgent emergency attention. And meanwhile, reduce your stroke risk by controlling blood pressure, not smoking, managing atrial fibrillation and other conditions with your doctor, and healthy living. Recognizing a stroke with fast and acting immediately can save a life and prevent terrible, permanent disability, making this one of the most important things you can know. So take care of yourself and those around you. Remember fast. Know the sudden signs. Never wait. And call emergency services the instant you suspect a stroke. And because a stroke is a dire, time-critical emergency, please treat any signs of a stroke, even if they pass, as your reason to call emergency services immediately, without delay or hesitation, rather than waiting or judging it yourself, and discuss reducing your stroke risk with your own physician.